Good morning, everyone. Welcome to our final quarterly meeting for all ages, all stages for supporting older adults and their families. We're so thankful for Kay Castillo and Janisha Hennigan as our work group leads who will be hosting this quarterly webinar. Just for some quick housekeeping, we do wanted to say that if you are going to be coming off mute or off camera, please do say your name so that the interpreters can make sure that we have you pinned, and then also you can go ahead and begin speaking. Thank you all again for being here. And with that, I'm going to turn it over to our wonderful speakers, Janisha and Kay.
Good morning, everyone. And as Divya said, welcome to our July quarterly webinar for all ages, all stages, North Carolina's multi-sector plan on aging. We are at the work group leads for supporting older adults and their families. I'm Janisha Hennigan. I'm the director at Central Pines Area Agency on Aging. And I'm happy to have my co-lead, Kay Castillo here with me, the executive director for Friends of Residents in Long-Term Care. Before we get started, we'd like to acknowledge and extend our special thanks to Joyce Massey Smith, Mary Bethel, Divya Venkat, Kaylee Weaver, and the steering committee for their guidance for all ages, all stages NC. And also thank you to our external leaders whose support has helped advance the recommendations that align with this works group goals. Now I'm going to turn it over to my co-lead, Kay.
Thank you so much. Hi, everyone. I'm Kay Castillo, and happy to be here with you all today. Again, welcome to the All Ages, All Stages July quarterly webinar, supporting older adults and their families. These quarterly webinars are designed to foster connection, learning, transparency, and meaningful progress. They help us maintain momentum as we implement the plan's goals. Today's session is the final webinar in a series of 4, each focused on a core area of the plan. We will share updates on progress, highlight key partnerships, and explore how this work is making a real difference in the lives of older adults and their families across North Carolina. Here's what you can expect today. A clear understanding of the supporting older adults and their families focus area within All Ages, All Stages, North Carolina, which emphasizes the vital role of caregiving, home and community-based services, and inclusive supports that allow people to age safely and with dignity in their communities. Insights on how, through the implementation structure, we are advancing recommendations related to caregiving and long-term care services and supports, and connecting statewide efforts with national caregiving priorities. Examples of cross-sector collaboration and partnerships that strengthen family caregivers and expand access to person-centered services. And then practical opportunities for you and your organization to get involved and contribute to the ongoing success of All Ages, All Stages NC throughout North Carolina. We appreciate your participation. Your voice, leadership, and partnership are essential to turning this plan into meaningful action that supports older adults and their families now and in the future. Next slide, please. So what is All Ages, All what is All Ages, All Stages NC? All Ages, All Stages NC represents North Carolina's comprehensive 10-year multi-sector approach to preparing the state for a changing demographic landscape. The goal is to improve how current systems work and connect so we can better support older adults and people with disabilities. Right now, many services and programs exist, but they can sometimes be confusing or hard to access or overlap in ways that waste time and resources. By working together across different sectors like healthcare, housing, transportation, and social services, we can create a smoother, more coordinated system. This means people get the help that they need more easily and quickly. When organizations share common goals and communicate well, we reduce duplication. So we are not repeating the same work or competing for the same resources. This makes our efforts stronger and more efficient, strengthening limited resources farther. Ultimately, this coordinated approach builds a future that is fair and responsive, where all North Carolinians can get the support they need to live safely, comfortably, and with dignity throughout their lives. If you tuned into any of the other webinars earlier in the series, you might notice some recurring themes and visuals in this presentation's opening slides. That is deliberate. Lasting change requires ongoing dialogue and a shared commitment to these goals. This effort is not just about introducing new ideas, it's about changing how we think about aging, how systems connect, and how communities serve all residents throughout their lives. Looking at these ideas again and again helps us all stay focused and committed. To succeed, we need to do more than just know the plan. We need to live it, shape it, and work on it together. Now we want to take just a moment to recap the journey North Carolina has taken from 2022 until 2025 in developing and advancing its multi-sector aging plan. In 2022, the North Carolina Department of Health and Human Services joined a national collaborative with 9 other states focused on multi-sector aging plans, which provided valuable insights into best practices and effective frameworks from leaders across the country. At the same time, AARP North Carolina partnered with the Department of Health and Human Services to pursue the age-friendly state designation. And together they launched the Age My Way NC initiative to support communities in becoming more age-friendly and to promote policies that help people age with dignity and independence. In 2023, after thorough needs assessments that highlighted key gaps and priorities, former Governor Roy Cooper issued Executive Order 280, and our state joined the Age Friendly Network. This order tasked the department with leading the creation of a multi-sector aging plan in partnership with state agencies. It also directed improvements and protections for vulnerable adults, expanded nutrition services, increased broadband access to reduce digital inequities, and strengthened support for caregivers. That same year marked the formal start of the All Ages, All Stages planning process. Stakeholders from health, housing, transportation, social services, advocacy groups, and people with lived experience were deeply engaged through forums, surveys, and meetings. This broad input resulted in over 160 recommendations to address the needs of older adults and people with disabilities. In 2024, we launched a focused media and outreach campaign to raise awareness among the public and stakeholders called I'm Still Here. Meanwhile, the team carefully prioritized the recommendations, narrowing them to 41 actionable steps grouped into 8 priority areas to direct attention and resources where they can make the greatest impact. The final plan was published in September of 2024. Since then, the emphasis has shifted away from planning and into implementation as the state and its partners begin putting these priorities into action, tracking progress, and making adjustments to improve the lives of North Carolinians as they age. Supporting older adults and their families is one of the 4 core focus areas in North Carolina's All Ages, All Stages NC multi-sector plan for aging, alongside optimizing health and well-being and strengthening communities for a lifetime and affording aging, as you see here on the screen. For the first 2 years of this 10-year plan, 8 shared priorities guide our work. As we shift from planning to implementation, we are focused on strengthening the formal and informal systems that older adults and their families rely on every day. This includes recognizing caregiving as a key priority and expanding access to home and community-based services that allow people to age with dignity and choice. Across the state, we are seeing momentum. We are thankful to see local leaders, advocacy groups, providers, and public agencies working together to identify gaps, align efforts, and improve how we can support caregivers and families. From Medicaid innovation to caregiver education and respite, these partnerships are laying the groundwork for sustainable, person-centered care. To truly meet the needs of older adults, we must continue coordinating across counties, community networks, health systems, and aging services. Through collective action, we are looking forward to reducing fragmentation where they exist, strengthening supports for families, and helping ensure that every North Carolinian has the opportunity to age well at home, in community, and with the support that they need.
The Supporting Older Adults and Their Families goal is about strengthening the systems that many rely on as they age, especially home and community-based services and supports for family caregivers. This includes both traditional aging services and efforts that respond to the needs of people with disability. This goal sits at the heart of how we think about healthcare for older adults. It reflects the critical role that providers, community partners, and families play in ensuring that people have consistent access to the resources and care they need to live safely and with dignity. For the first phase of implementation, we're focusing on 2 key priorities. First, expanding and improving home and community-based services. 2, increasing support for family caregivers. Again, these priorities work hand in hand to build more coordinated, responsive system that supports older adults and the people who care for them. Unlike the other 3 work groups where the project leadership team has created new all ages, all stages North Carolina work subgroups, the supporting older adults and their families work group operates a little differently. This work is fully externally led for now, meaning it is housed outside of the formal state-led subgroup structure. That is intentional. Why? Because North Carolina already has strong, well-established coalitions and leadership networks that are advancing work in this space, especially around caregiving and home and community-based services. Rather than duplicating those efforts, our goal is to amplify and align with what is already happening. These external groups bring together voices from across sectors, advocacy, healthcare, policy, direct service, and individuals with lived experience. Their work is grounded in cross-sector collaboration and shared leadership, which matches the values of the All Stages, All Ages NC plan. This structure also helps us stay connected to real-time developments across the state. It allows for shared learning, more flexibility, and better alignment with statewide efforts already underway. These external and internal efforts are not separate from the plan. They are central to it. They reflect how we are building on what already exists, promoting cross-sector collaboration, and offering space for shared learning, alignment, and real progress across North Carolina. For caregiving example, we intentionally split the work into 2 tracks, one focused on broader family caregiving and another on referral access to care, focusing on the no wrong door system. Because while they are related, they involve different strategies, partners, and infrastructure. Second, for home and community-based service, this work is currently being held internally with a focus on the Older Americans Act final rule, which you will hear more about later in this presentation. In year 2 of implementation, we plan to stand up a formal all ages, all stages NC subgroup specifically focused on home and community-based service to deepen that work and connect more partners. This future subgroup will take a deeper look at key issues such as access to services, funding and reimbursement challenges, system navigation, provider capacity, and equity in service delivery. The goal is to bring together a broader range of partners to strengthen and expand community-based supports across the state. Advancing the goal of supporting older adults and their family requires a collective commitment to strengthening, caregiving, and expanding access to home and community-based services. This work recognizes that aging, caregiving, and community-based care are shared responsibilities across families, providers, communities, and the state. No single agency or sector can meet those needs alone. As this slide shows, our approach is grounded in 5 key principles. First, we're working toward a unified vision where caregiving and access to home and community-based services are seen as core to how we support aging in North Carolina. That means understanding these issues are not side efforts, but central to health, equity, and community well-being. We are also centering the voices and leadership of older adults, family caregivers, and diverse communities, ensuring that solutions are informed by lived experience and responsive to the real challenges people face every day. Our focus is not on creating new systems from scratch, but rather on co-designing sustainable solutions that strengthen the long-term services and supports already in place. This includes expanding access to in-home care, respite, navigation support, and other services that allow people to age in a setting of their choice. To do this well, we must coordinate across sectors, health, housing, social services, advocacy, and more to align resources and programs so that services are easier to access, more person-centered, and better integrated. Finally, we are committed to building a culture of learning and accountability where partners share data and track progress transparently. This helps us stay focused on real outcomes, better support for caregivers, expanded home and community-based access, and improved quality of life for older adults. We are grateful for our UNC chefs and Division of Aging Planning section for data-driven decision making.
And Kay here again. Now you will hear from representatives who are helping to connect these external efforts with the All Ages, All Stages NC plan. These leaders serve as the bridge between the statewide vision and the on-the-ground work already underway. Through them, we are ensuring alignment, sharing lessons, and lifting up what is working across North Carolina. Again, their insights reflect the importance of building on what already exists and reinforcing cross-sector leadership that supports older adults, caregivers, and community-based care. At a high level, the Supporting Older Adults and Their Families work group or goal is guided by 3 key efforts, each tied to existing initiatives and partners already advancing this work. Home and community-based services, which is focused on aligning North Carolina's policies with the new Older Americans Act final rule and modernizing our data systems to better support service delivery. Caregiving, which aims to strengthen support for family caregivers, expand consumer-directed options, and sustain tools like the North Carolina Caregiving Portal. And last, referrals and access to care, or No Wrong Door, which seeks to improve how people find and access services by building a unified referral system and enhancing platforms like NC 211 or NC Care 360.
Janisha again. Now I'm going to turn it over to Misty Picard McWilliams and Katie Kutcher.
Hey, Janisha, thank you for that. I am Misty Picard McWilliams. I just want to make sure that everybody can hear me because I know I'm just coming on. So okay, Katie said yes, perfect. Okay, so Katie and I are tasked with the Older Americans Act, and what we are tasked with is essentially updating the final rule. So ACL put out final rules, which are federal regulations. And those federal regulations dictate to the State Unit on Aging, which is the Division of Aging, in addition to the AAAs, which are the Area Agencies on Aging, in addition to the providers who receive the fund from those services on what to do. The Older Americans Act, for those of you who don't know anything, and I always assume there's one person who doesn't want to speak up, it was established in 1965 to build support and community-based services for seniors. It was the same year that was done as Medicare and Medicaid. And just so you all know, I'm not sure if anyone is aware of this, or maybe with this group, we're all aware of this. Today is actually the 60th anniversary of Medicare and Medicaid. So be aware that most people know about the establishment of Medicare and Medicaid. A lot of people don't necessarily know about Older Americans Act. And what this does is again, it's the support networks, right, for someone who can stay in their home as long as possible. Every 5 years, the Older Americans Act must be reauthorized by Congress. Congress will say, hey, this is what we want to focus on. So in last reauthorization, which was in 2020, there was a lot of pushing by Congress to really focus on what caregiving is. Is a caregiver this type of person? Is a caregiver this type of person? And what does caregiving actually mean, right? And the reason for that is because Congress attempts to assist with maybe bringing some real ideas into how the law needs to implement those. In 2016, as an example, it was all about the Ombudsman program. So again, every 5 years that the Older Americans Act is reauthorized by Congress, be aware that it's really to try to focus on a certain area. It's not required by Congress, it's just what they do. So for those of you who don't know, there are multiple federal agencies who take orders from Congress, and one of those is the Administration for Community Living. That is the group who is tasked with establishing rules and regulations for the Older Americans Act. And they periodically do update the federal regulations. So at the highest level, and I'm sorry, I'm an attorney by trade, so the geek comes out in me. Congress does United States Code. That is the law of the land. On the other hand, ACL, which is a federal agency, they issue what's called CFRs, Code of Federal Regulations. And they do update those periodically, but when they do, just be aware it's not like it's done every 5 years in relationship to the reauthorization. So in reality, it's been a really long time since we've had new codes of federal regulation. And those were, just so you know, implemented in 2024, they came out, and 2025 is the effective date. So the effective date is essentially March 15th of 2024. That means they were put out and they said, hey, moving forward, the Administration for Community Living expects State Unit on Aging, area agencies on aging, and providers of Older Americans Act funding to comply with these regulations. There was a comment period. There was the opportunity to take and provide feedback, in which many of us did. And there was no requirement for them to adopt our comments. But what I can say is that it seemed like they were really looking out and hearing what our comments were. Specifically, we were saying, hey, there's much more demand than there is supply, right? And so they were really receptive to that. October 1st of 2025 is the compliance date. This means that State Unit on Aging shall be in compliance with these final rules. And if this is being sent out, I assume it is, then I always include hyperlinks if you know anything about me. So be aware there's a hyperlink to the entire CFR if you're interested. And Katie, is there anything you want to add to this since we're co-sharing this?
Just want to say thank you to Misty for your leadership during this process. And I'm sure you'll talk some about how there's a variety of different work groups to help us get into compliance with the final rules. And so just want to recognize all the staff at the Division of the Aging. There's a number of representatives from area agencies on aging across North Carolina and direct service providers who are working together to make sure that North Carolina comes into compliance. So it's definitely a team effort. So just want to recognize everyone's participation in that.
And Katie is correct. So there were work groups that were developed around what we presume to be the services most impacted. That was nutrition, ombudsman, emergency management, planning and administration, caregiving, and legal services. For those that are service specific, nutrition, ombudsman, caregiving, and legal services, those, of course, they're pretty much towards the end of the process. But as you can imagine, planning and administration, that deals with private payers, it deals with commercial relationships, it deals with designation of area agencies on aging, and then the one that I personally hope to put off to the last, because I'm involved in this, would be the intrastate funding formula. No one's ever happy when you're looking at the money, right? So these work groups were established, and what happened is they do meet routinely, and they review the Older Americans Act, which again is the United States Code. That's the law of the land. After that, they compare it to the final rule. So what is it that they're looking at? And the final rule gets specific, and that's the one that's implemented and established by Administration for Community Living. But do be aware that for CFRs, which are the final rules, they have to be applicable to the territories and the states. So there's still a lot of stuff that the specificity that the states have to basically put into place in order to meet the CFRs. And then after looking at the federal laws, we then compared them to the program manuals, the standards. Some people refer to them as program manuals, some people refer to them as standards, but we're looking at the same thing. And we have determined that there's items that need to be corrected that have been unmasked. So what I mean by that is of course we knew there would be changes, but what we also thought would happen, which is what is happening, is that there's other things that are coming into our purview of, well, maybe we should look at this too. An example of that might be, for example, as you know, the Division of Aging had adult services moved to us. It's now been moved to the Division of Social Services. And a lot of our priority service clients were those in the DSS realm. So the question is, does it really make a difference if we serve those same people? And I'm hearing back noise. Is it just me? Okay.
Yeah, I got it.
Okay, thank you. All right. So the question is does that DSS population, does that still serve as a priority group of people for us to serve? Again, not something that the CFR looked at, but something that was unmasked, if you will. And if you look at that, then you have to look at specific forms put out by the State Unit on Aging, which is the Division of Aging, to see if that needs to be changed. Things that we have discussed. Well, I'm going to ask Katie what her thought is about nutrition because she is by far one of the best experts about nutrition. So, Katie, is there anything that you think that would be beneficial just to let them know of things that we've discussed in nutrition?
Just as you were saying, this is really an opportunity to make sure that we're coming into compliance, but also some of the changes under the final rule are maybe allowing some more flexibility for providers, which we think is a good thing, right? In terms of being flexible and being able to meet the needs of older adults in the community. So some of the things that are being looked at in the realm of nutrition would be related to medically tailored meals, for example, the opportunities for grab and go meals. Also, prioritization of service to serve most in need. So those are a few of the areas that we're looking at, evaluating, and making sure that we're updating the state standards to fall into compliance with the new final rule. So those are a few examples, and I think we're excited about some of these changes, knowing that it should provide some more flexibility for providers to meet the needs in their communities.
And then other examples would be in legal. It is now a requirement that the client that is being served in legal services is provided the opportunity to receive those legal services in their native language. For some of our providers, that's not an issue. For other providers, that may be an issue because of budget constraints. Another example for legal services is that there's been a request from ACL to really take and include financial understanding and financial budgeting as part of legal services so that that individual client is not a product of a guardianship. As far as planning and administration, the one that's probably been focused the most is private pay relationships. So if you've been in the Older Americans Act, you know that a lot has been stated about ROI and how return on investments for the Older Americans Act, how that is established, plus this business acumen, which is the word that everybody's been saying apparently. And so there is a requirement from the CFR saying that any private pay relationship, the State Unit on Aging would have the ability to review those. Working at the State Unit on Aging, obviously we want to create some type of template where if it's done, it's good to go. There would be no desire that I'm aware of us looking at every individualized contract. So we are basically deciding what needs to be done. So once all these are done, so upon completion, the proposed draft manuals will be put out for review. This would be to the general public, just so you know, and this is taken from rulemaking because I also serve as the rulemaking coordinator. So I feel like this serves very well in general. So what happens is there will be a comment period. It'll be probably 10 or so days, right, for people to make comment. And the reason for that is because in doing this for rules, comments come in at the very beginning, at the end. So if you extend the time, then be aware that as a result, you don't get a lot of comments in the middle period. The work groups will then either approve the comments, amend the comments, or reject the comments and adopt those into the standards or program manuals. So an example of this is in the nutrition work group, we were thinking about shelf-stable meals, and we were informed, and we never even thought about this, that in some areas of the state, you can only get shelf-stable meals in certain quantities. So we had proposed the idea of 2, and 2 would not be feasible. So the idea of having the general public comment is because as a State Unit on Aging and or a AAA representative, it may make sense to you, but it may not be just feasible for someone else. On the other hand, there's also stuff that we have to realize that it may be that this particular provider and or region wants to do this, but there may be a limitation either at the state level, a budget restriction, or something else that, whereas the comment is well intended, it simply cannot be approved. So that's why I say that the work groups will approve, amend, or reject the comments. The effective date will be determined, but it would be very hard pressed, if you guys recall, to make them effective October 1st of 2025 because all contracts have been signed. In addition to that, what I will say is that just because we do have our budget set up for July 1st, which is the state fiscal year, it probably will make sense to do that. Now, if you recall from the previous slide, ACL, the Administration for Community Living, said that October 1st, 2025 is the compliance date. However, we do have a very, in my mind, understanding federal partner, and they realize that this may not be able or accomplished by that date. So what they're looking to see is that we have made good faith effort to align these OAA final rules, and we have. Most of the groups are pretty much towards the end, but again, we have to let the budget play out. In reality, we have to let the providers have the knowledge and the understanding of how this will impact them. So that being said, thank you very much for your time, and thank you, Katie.
Hi, good morning, everyone. My name is Amanda Swanger. I am the Family Caregiver Support Program Coordinator and the Lifespan Respite Project Director. I am overseeing the caregiving group. And as Kay had mentioned earlier in the presentation, the 3 recommendations that we are focusing on during this implementation stage are making sure that we can provide family caregivers with more support, including a larger range of comprehensive respite services, expanding our consumer-directed options, which can provide greater flexibility in caregiving arrangements and enabling caregivers to choose who they would like their respite providers to be. And then lastly, looking to sustain the North Carolina Caregiving Portal. Next slide, please. So recently we submitted our final report for our Lifespan Respite Grant that took place during 2020 through 2025. We submitted it, it was accepted by ACL. And so we just wanted to highlight some of our accomplishments during that grant period. So our first one was we did expand direct services. So over 1,500 caregivers received respite vouchers statewide. And just a little kind of overview of Lifespan Respite. So it is one of the 3 caregiving programs that are administered by the state. Lifespan does offer respite vouchers to caregivers. And the goal of Lifespan is to serve those caregivers who may fall through the cracks. So those who may not be eligible for other caregiving programs or who may not be eligible for other federally or publicly funded services. And so we strive to serve those caregivers who may not receive services elsewhere. Along with serving 1,500 plus caregivers, we had some key partners within that grant period. So of course, our fiduciary agent, High Country Area Agency on Aging, they are the ones that look over applications, that process reimbursement vouchers, and who serve our caregivers. Project Care was another partner. And we were able to allocate some funding for extra Project Care respite vouchers. And then the ALS Association, the North Carolina chapter, we were able to allocate some funding to provide that organization respite vouchers as well. Within this grant period, we also strengthened training and outreach. So 3 new online training modules were created to discuss how to plan for respite, how to educate caregivers on the importance of respite, and those are continuing. Those models are still available. We created bilingual flyers and triage resources. So all of our program materials, including outreach flyers, respite, timesheets, all of our program documentation was translated into Spanish to better serve our Spanish-speaking caregivers. And then also we provided many statewide presentations and targeted outreach to underserved groups. So we realized in looking at the data that certain parts of North Carolina were not served with respite vouchers. And so with our current grant, we were working to ensure that all parts of North Carolina are served with lifespan respite vouchers. Another key activity that we wanted to highlight was we built the Volunteer Respite Network. So our partner, the Center for Volunteer Caregiving, located in Cary, they built the Volunteer Respite Consortium. That was created, a toolkit was created to help volunteer respite programs get up off the ground, give them best practices, some resources for implementing a volunteer respite program. Within that consortium, there are 20 programs that are collaborating across the state to help educate those on building a volunteer respite program. Of course, within this grant period, we experienced the COVID-19 pandemic. And so within this grant, there were surveys provided asking service providers how they adapted services, how, what were some of their virtual and safe practices. And so a few of those surveys were completed during this grant period. And then lastly, we created sustainable impact within the last grant period. So we're continuing to administer respite vouchers. So we are currently working under another lifespan respite grant. That one was awarded in 2023. And so our focus with the current grant is, again, we want to make sure that we reach all areas of North Carolina, especially the more rural counties. Again, we would like to provide more services to our underserved population. So our Spanish-speaking caregivers, and again, wanting to focus on different groups of caregivers. We have our ongoing partnerships with our Lifespan Respite Advisory Team. And then we have also valuable partnerships with an organization called Akalaka, which helps serve sibling care partners who are caring for siblings who may have IDD. And then also we have our partnership with El Centro Hispano. They have been very valuable in helping serve our Spanish-speaking caregivers, and we are very thankful for their partnership. And then lastly, just wanted to brag a little bit about our lifespan program. So after caregivers are awarded vouchers and after they have used their entire voucher, we do ask them to complete a satisfaction survey. And then we collect that data. So out of all of the surveys that were collected, we had a 100% caregiver satisfaction. We still know that there is room for improvement, but we were very happy to see that all caregivers who received respite vouchers benefited from those. And so, again, we want to expand respite and support all North Carolina families. So with that being said, I'm going to turn it on over to Casey Odom, who will give you updates on the North Carolina Caregiver Portal.
Good morning, everyone. Thank you for allowing Amanda and I to be here. My name is Casey Odom. I am the Project Care Specialist and the No Wrong Door Consultant with the Division of Aging. Just a couple updates regarding the North Carolina Caregiver Portal. Our contract update is that we are currently discussing ways that we can diversify our funding for True Alta leadership with our True Alta leadership team, who is the partner agency for the North Carolina Caregiver Portal, to ensure that we have sustainability for the portal over the next couple of years. So that's something that we are currently working on. Between July 1st of 2024 and July 15th of this current year, we've seen 90% of the counties are represented on the North Carolina Caregiver. Overall, we have 98%, so we only have a couple counties left to get on the platform. We have a total of 719 registered on the portal between that July 1 and July 15th date. 80% of those are self-enrolled, which means they are caregivers that have been actively looking for resources on their own. They're signing up for the caregiver portal. And then we also have about 20% that are registered by an invite from one of our local agency partners. In total, we have about 2,732 registered caregivers on the portal total. And we have been averaging about 69 users per month since January. So we find that's a really great success. One resource that TrueAlta did provide this year for our local agency partners were the North Carolina Caregiver, the TrueAlta Learning Library Catalog, which basically lists all of their trainings available on the platform. And so when caseworkers and managers are working with their team, they can share the resources and what guides and manuals and resources would be available to them from trusted sources. So we're excited to share that with our providers as well. On the screen, you'll see a QR code to register for the that will take you to the North Carolina Caregiver Portal. So feel free to share that as you feel you need. And Kaylee, I'll get to the next slide. I'm also going to talk a little bit about referrals and access to care. So those recommendations were to create a unified referral system with no wrong door approach, so caregivers can receive tailored and accurate information, referrals, and access to long-term services and supports, no matter which door they walk through. Also, to enhance the North Carolina 211 and North Carolina Cares 360 platform as comprehensive resources for older adults and people with disabilities to obtain information and connect in needed services such as housing, healthcare, food, transportation, and lifelong learning resources. So a lot of that work falls under our governing body within the No Wrong Door work group. We're excited to announce that the UNCA, North Carolina's at Asheville Provost has given the green light for the North Carolina Center of Health and Wellness to accept the award for the Enhancing State No Wrong Door Systems for Efficient Access to Long-Term Care Services and Supports grant, which is a second part of that grant. They had initially received the first part a few years ago. So we're excited that they will be accepting that second part. They've informed ACL at this time that they will be posting a job opening for a project officer for that specific project. I'll continue to work with some of their staff until that project officer is identified. And they have a meeting this week we had a meeting actually on the 21st to share these updates with the governing body. We've also been, as a governing body team, identified 3 main priorities for the next stage of this grant, which are to identify the governing body's first lead and co-lead entities, to identify any additional representation needed for the governing body. And then we're also in the works to develop a statewide person-centered counseling curriculum to help push this work forward. We also had a presentation from the North Carolina Cares 360 team and long-term services and supports, which was conducted in April of 2025. We did have to cancel our May meeting due to some conflicts, but in June, we did put out a survey to our governing body to find out what our next steps are moving forward. And our next meeting will be on Monday, August 18th to convene on this work. We did have an excellent meeting thanks to Divya, setting us up with our team in Maryland to learn about their No Wrong Door work and we're excited to take some of their best practices and move that forward with our work here in North Carolina. So again, our next meeting is August 18th, and we'll have more updates for you then.
All right, and Kay here again. Thank you so much to our liaisons and to everyone working so hard to bring this plan to life and making sure that at the end of the day that we have the supports for older adults and their families that we need. Now, I am so thrilled to welcome two exceptional leaders who are helping shape a stronger, more resilient care system for North Carolina. Their work is not only advancing the field, but also grounded in deep personal and professional commitment to caregiving and aging well. So first, I want to introduce Dr. Heather Altman. Heather brings over 25 years of experience in the nonprofit, healthcare, and aging services sectors. Her work centers on advancing community-based initiatives, programs, and policies that support aging, caregiving, and serious illness care. After 17 years of leading innovative outreach programs at a continuing care retirement community, she shifted her professional focus to embrace the deeply meaningful role of caregiving for critically ill family members. Today, Dr. Altman serves as Executive Director of the North Carolina Serious Illness Coalition. She hosts the coalition's online series Friday Facts, and she also hosts a really great community radio show and podcast called Aging Well Together. She works directly with families as they navigate the complexities of caregiving and long-term care. Dr. Altman earned her Master in Public Health and her Doctor of Public Health from UNC Chapel Hill, where she also serves as adjunct faculty. Joining her is Karen Appert, co-lead of the North Carolina Caregiving Collaborative and a program manager for the Senior Farmers Market Nutrition Program at the North Carolina Division of Aging. Karen's work is fueled by a deeply personal caregiving journey, which encompassed 25 years of caring for her mother, who lived with MS and dementia. That experience now informs her statewide leadership in caregiving advocacy, program development, and cross-sector collaboration to support caregivers and families across North Carolina. This session will spotlight the North Carolina Caregiving Collaborative efforts to strengthen support for family caregivers statewide. The collaborative brings together partners across government, healthcare, advocacy, and academia. The presentation will highlight connections to national priorities, including the national strategy to support family caregivers, and explain how the collaborative's projects, such as the statewide landscape analysis of supports for caregivers and Medicaid advocacy tied directly to All Ages, All Stages NC, to the implementation and opportunities for input and engagement will also be shared. So please join me in warmly welcoming Dr. Heather Altman and Karen Appert.
Thank you, Kay. Can everyone hear me okay? I want to make sure about that first. Can you all hear me?
Yes, we can hear you.
Okay. I didn't see I didn't see any
thumbs
thumbs up. I'm looking across. Thank you. I'm Karen Appert. I appreciate the opportunity to be here. I want to thank Kay and Janisha for allowing us to come speak. And I also want to thank Divya and Kaylee and all the work group leaders and all the volunteers on this this incredible effort for the multi-sector plan for aging. I know it's not an easy thing to corral all the people that are involved in this, and we really appreciate all your efforts. So I'm going to do a quick kind of overview of our North Carolina Caregiving Collaborative. I did want to mention that, Kay, I appreciate that nice introduction, and just wanted to mention that as a former caregiver, my mom did pass away in 2023. So, you know, doing it for as long as I did, it made me pretty passionate about continuing the efforts of advocacy that often caregivers can't take on themselves because they're advocating for their loved ones. So they're not typically looking, you know, to advocate for their needs. And so we look at this North Carolina Caregiving Collaborative as as a way for those of us who are caregivers or have been caregivers to continue efforts for advocating for better supports across our state. I also wanted to mention that we're joined today by Katalia Alexander, who will be sharing a little bit more about a project that we're working on and she's helping us with. And so she will introduce herself a little later in this presentation. You can go to the next slide, please. So a quick background about our group. We are a volunteer group. We were formed in 2021. It was originally formed by members of the North Carolina Serious Illness Coalition, the North Carolina Coalition on Aging, and the Children's Complex Care Coalition of North Carolina. So those three groups had caregiving as an aspect of what they were doing. And what we all started talking about very casually at first was the need for a group that spoke about the needs of caregivers as the main focus that we were working on. So we started coming together in November 2021, and I just have a list here of who our members are associated with. So we're not a membership organization because we are a group of volunteers, but we have some pretty impressive background for the people who are coming to our meetings monthly or engaging with us in some way. So we just wanted to mention that because we do have extensive experience as far as the people who are members of our group. So we're independent, we're not affiliated with any agency or organization, which allows us to work with agencies and organizations that are doing the programmatic work, what we like to call boots on the ground. So 2021, to start talking about this was fortuitous. And if you go to the next slide, oh, I'm sorry. I'll talk about the timing. No, go ahead to the next slide. Sorry about that. This is our purpose statement. I forgot that I had switched those around. So our purpose statement gives a little overview of what we try to do with whatever we're working on. We are a convener of organizations and individuals engaged in caregiving advocacy. And the words I'd like for you to focus on or think about as we're talking through everything we've accomplished so far are the three words I like to think about are the convener, because that's what we're doing. We're convening groups. We're not doing the programmatic work or the service work. The advocacy is obviously a very big important part of everything we do. And then if as you look at a little bit more of the description in the second paragraph, the word lifespan, we talk about that a lot, that we are looking at those who are caregivers across the lifespan. So whether someone is caring for a child with a serious illness or disability all the way up to older adults, where there are needs, we want to look across the lifespan, because we have found that caregivers need supports. Those supports often are similar regardless of the age of the care recipient that the caregiver is working with. You can go to the next slide, please. So as I was talking about the fortuitous nature of coming together starting in 2021, this shows a little bit about what was going on at the national level at that time and around that time. Of course, for those who have been doing caregiving advocacy work for longer than I have, 2014-15 was a big year when the CARE Act was introduced. And AARP gets a lot of credit for making that such a big part of the national conversation. So a few years later, the Raise Family Caregivers Act was introduced as law January 2018. That sort of set the stage for some of the other initiatives that happened afterwards, in which we've been able to then work with and enjoy getting to know more about. That basically encouraged, or actually required, that a national strategy to support family caregivers was created, and that was introduced to Congress in September 2022. That has 5 overall goals, and we'll talk more about that in some of the initiatives that we work on and projects that we work on. But in between that time, right before that came out, there was a grant opportunity that we found out about called Changing the Care Conversation. That was funded by Grantmakers and Aging, and the first facilitator of that grant was Community Catalyst. You can go to the next slide, and I'll talk a little bit about how that has sort of informed everything we're doing now. So there have been 2 phases to the grant, and they're called different things. That gets a little bit confusing, so I don't want to go into too many details. But basically, that Changing the Care Conversation grant was encouraging. There were 10 states involved in that grant. North Carolina was one of them. And it encouraged the states to recruit and train caregivers to use their lived experience for advocacy efforts. And again, if you look at the timing, it was right before the national strategy came out. So our group, and I don't know if Heather Burkhart is on this, but at that time, Heather Burkhart was my co-lead on that initiative. And with that, you'll see the 3 goals we had for that phase. And it had a lot to do with working with these caregiver champions that were part of at our state level, and we developed some videos that they made. Those are on the website where there's the link at the bottom of the slide. And then we did a caregiver policy summit for North Carolina. In phase 2, which really just ended recently, but of course these are just what we're doing on the national level. That doesn't mean our work has stopped, but our goals for that phase were coalition building, and then this landscape analysis project, which Katalia will talk about in a little while. And then again, we see the need every time we're working on any projects for that lived experience, making sure we have the voice of caregivers in everything we do. And I just put a very hopeful TBD on phase 3 because we're waiting to hear if there will be another grant funding opportunity for us. Next slide, please. So that just ties into the background of the national activities that we're doing here. I've really gone through most of that, but the Caregiver Nation Network continues. That second phase, I did forget to mention, the second phase was the facilitator became the National Alliance for Caregiving. And though they were part of the first effort, it's really now they're leading this effort, and we get to have bi-monthly meetings where we get to talk with the other states in the initiatives. We get to share best practices. We get to learn about what's working and not working for states as far as caregiving supports go. And then for the last 2 years, and then going into this year, we'll also be able to attend the Caregiver Nation Summit, which the National Alliance for Caregiving hosts in DC, and we're able to not only do some workshops and convene with these other states, but then also we have a Hill Day where we visit legislators, state legislators, and talk about the needs of caregivers at the state level to our national representatives. Next slide, please. This just covers a few of the activities we've undertaken for the past few years. The thing I would like to call out is that we were able to participate in an initiative last year with the Essential Jobs, Essential Care initiative of the North Carolina Coalition on Aging with the fabulous Trish Farnham. And we were able to partner in advocacy efforts for family caregivers and direct care workers. That ended up being, again, incredible timing that we started working on those efforts because, as I would say everyone on this call knows, at the beginning of this year, some of our efforts had to switch from some of the plans that we had for projects we were going to work on to Medicaid advocacy, because that is a big, we saw the need for the Medicaid advocacy as it related to some of the challenges faced by caregivers. We found that that was just really important for us to jump into. And we see, even though that bill has passed, we see our advocacy around that issue maybe even needing to be a little bit bigger as we go forward as those effects from that bill come to the state level. So now I would like to introduce Catalia Alexander. Actually, I'll let her introduce herself, who has been helping us on this landscape analysis project that we started earlier this year. And Catalia, if you're ready.
Thank you, Karen. Yeah, so as Karen mentioned, my name is Catalia Alexander. I am a graduate student at UNC getting my master's in social work and public health, and I'm completing my practicum with the Serious Illness Coalition and the Caregiving Collaborative, and have had the opportunity to spearhead our landscape analysis project this summer. So wanted to share just kind of a brief overview and some early takeaways from that project with you all. So the goal of this landscape analysis really is to understand what is out there to support caregivers in North Carolina across all of the different counties in the state, as well as where are there gaps. And so this has looked like really trying to inventory the different resources and services on a county by county level, so we can identify any disparities that exist between counties and regions. And as a note, this is not really intended to be like a consumer-facing project, like a resource guide that gets given out to caregivers, but is more for providers and advocates doing kind of the higher level work to really understand what is out there and shape kind of work going forward. Next slide. And so just touching super briefly on what we're including, again, because caregivers is our area of focus, we really just want to include programs and services that have a direct benefit to caregivers. And we made a few decisions on what to exclude. So for example, we know housing options like long-term care and assisted living facilities also benefit caregivers, but we chose to exclude that, as well as in-home health and in-home companion care agencies, as well as hospital or healthcare offices, unless they have specific caregiver support programs like support groups that are just for the caregivers. Also not including legal or financial resources. And then again, as we noted, we really want to look at direct benefits to caregivers. So if a service is primarily aimed at supporting a care recipient and there's no obvious benefit to a caregiver, then we chose to leave that out as well. And again, we're just listing those resources by county, and then we're also kind of separately tracking statewide and national programs. So if a group operates on a statewide level, they're only listed on that county resource sheet if they offer direct services in that county. So this is just a snapshot, so you can see what that spreadsheet looks like. But as you can see, listing just, the different resource names, who they're serving, what types of clients, and then the type of services they provide, as well as a little bit of info about each service. So to begin this process, we identified 10 counties to start our analysis with. We eventually would like to expand that number, but tried to start with just 10 and do a mix of different tier 1, tier 2, and tier 3 counties, as well as urban and rural and areas of the state. Again, so we can kind of have representation of different types of counties across the state, so we can really identify where there might be disparities or differences between counties and types of counties. To find resources to actually put in the landscape analysis, I used a mix of different search strategies, trying to really think about how caregivers themselves might actually find these resources. So a mix of using Google, AI, personal networks, things I know about from working in the aging space, as well as like any county web pages or resource guides that might exist. And then we documented that relevant information about each resource. Some of the things that have come up through this process, as I mentioned, trying to really use search strategies that are strategies caregivers might use. Honestly, one of the big takeaways from this is it can be really hard to find resources, even, if you just type in resources for caregivers, a lot of different things come up. Not all of them are super helpful. And so sorting through that can be really challenging. I think also knowing what terms to use and how to filter has been really interesting. And so again, that terminology might be less familiar to someone who's new to the caregiving space, which makes it challenging to find resources. I think another big thing that came up is that resources for older caregivers of older adults were much easier to find. Typically, if I search for, caregiver resources in X county, what you're going to find is resources for people who are caring for an older adult or someone with dementia. And so if you're a caregiver caring for, someone with a disability or a child with complex medical needs, you might have a harder time finding those resources. And then it's not always clear who is eligible for what resource, which poses further challenges. And then finally, we felt like it was important to make sure we were getting feedback. So we've really appreciated the feedback from members of our collaborative on what to include and how to go about this process throughout. So as mentioned, just some early takeaways. Like I said, caregiver resources are really predominantly aging focused, despite the fact that caregivers can serve a variety of populations. There's pretty large disparities between the availability and how many resources there are in urban counties versus rural counties, as well as between Tier 1 and Tier 3 counties. So income level and level of urbanness definitely impact resource availability. And then as we noted, if a statewide organization had a local chapter, we did include that on the county list, but it's not always clear how active and resource different chapters are. So for example, some organizations have, several different chapters in various regions, but some regions might have more going on or have more staff than other regions, which can create disparities even if there is technically the same resource available everywhere. And then just touching super quickly to complement the inventory, we also created and conducted a provider survey to gain perspectives on what resources were being requested from them by caregivers, as well as what resources were available and what gaps there were in their county. And so far we've sent this out to members of our collaborative, but we hope to expand this to other stakeholders who are serving caregivers in the near future. Next slide. As you can see, lots of different types of support were requested by caregivers. There was not necessarily one common theme that emerged, but I think highlighted just the variety and the depth of needs that caregivers have that they're seeking support for. And that in turn can create a lot of challenges for providers to be able to connect people to such a wide array of resources. Next. Again, we also asked specifically about barriers and service gaps that they noticed. One that came up, of course, was limited funding for programs. So even if providers were able to refer someone to a funding support program, there wasn't necessarily funding available when that person got there. Segmentation of resources. So again, based on population, some resources might only be for caregivers of a specific type of care recipient. Noted that there was less resources in the small towns or rural communities that these providers worked in versus more urban areas. Caregivers, as we mentioned, struggling to just know where to start and the challenges that come from trying to search for resources without one clear place to go. And then finally, providers also noted that they heard from caregivers that the having to join wait lists or having to wait a long time to hear back from resources was challenging and discouraging. Right. And so finally, just to wrap up, some next steps. As mentioned, we hope to continue to inventory additional counties on that landscape analysis spreadsheet, because while we think the 10 counties are somewhat representative, it really is better if we can look at a wider array of counties. Continuing to invite collaborative members and other stakeholders, such as you all, to share additional resources for inclusion as well as feedback, expand the distribution of that survey beyond our collaborative members, and then explore how this project can inform other caregiver support projects in North Carolina and report on our key findings. So thank you.
Okay, next slide. Are you able to hear me okay?
Yeah, Heather,
There we go.
no, it should,
There
but I think we should go back one because sorry. The next slide, I feel like we skipped two. Oh, never mind. Never mind. I thought we moved one more. Sorry.
Not a problem. Thank you. This is Heather Altman. I am uncharacteristically quiet during this presentation because we're so excited. Well, I've been following and been partners with Karen Appert for years, and she is just such, if you can't already tell, such a rock star when it comes to advocacy for caregivers, family caregivers. But really, it has been amazing to invite Katalia Alexander into this work. As she said, Katalia is a graduate student. She's an overachiever, getting her master's in both social work and public health. And we are so thankful to have her. Gratitude to all of you who support interns at the high school, college, graduate level. And this is hopefully a great example of the amazing work they can do. And so happy Katalia was able to share the work about the landscape analysis project. The data from the landscape analysis can inform other projects. And so we are working to find ways to weave it into other projects that are interested in resources for caregivers, such as the work that we're talking about today, the All Ages, the All Stages work, the North Carolina Caregiving Portal. Other work groups with All Stages and All Ages and All Stages have also mentioned the importance of support for caregivers. And so any way this work can be helpful, if it can help, we are hoping the state resources such as NC 211 and NC Care 360, they may benefit from an additional inventory of resources for caregivers that we're able to identify. I'm a big fan and I'm obsessed with our excellent caregiver research that's happening around North Carolina, and some of these research studies offer resources for caregivers. So any way we can help to share this information, we want to be able to do this. And we've already experienced that some federal and state legislators who were contacted directly by caregivers have also asked for this type of information. So it even helps with our advocacy work to give specific information. As Katalia said, we are not planning for this project to result in consumer-facing information. We are not direct service providers, but we recognize that there may be continued usefulness, and it relies on it being kept up to date. We are hoping to have an initial review of about 50 of the 100 North Carolina counties completed by the end of this year. We have Katalia, thanks to her double degree, she's doing an extra long internship with us. And so continuing on through the end of this year, early next year. As again, it may not be a thorough review of the resources in each county, but it should at least give us a starting point for the type of resources available. Again, this is an analysis project, what exists, what doesn't exist, and how we can share that information with providers and policymakers. We're hoping that we can continue to invite interns to help through the North Carolina Serious Illness Coalition or other organizations that support interns, so they can help to update this information. And then, of course, planning to continue to engage with our caregiving collaborative members and network partners to ask for their help in generating updates. All right, next slide. And we just have a few slides left just to talk about some of the other projects we're working on, just to let you know we do a number of different things. There's been a lot of focus about Medicare billing codes. The Medicare billing code for caregiver services, providers like physicians, physical therapists, OT, etc., can now be compensated for helping train caregivers to provide medical care for their loved ones. This is a relatively new in the fiscal year 24 and 25 physician fee schedules. So our group is helping to learn more about it, share information in order to increase outreach and education, to encourage more providers to take advantage of these codes in their work of supporting caregivers. As I mentioned before, we have wonderful researchers around North Carolina with our organizations, our academic communities, our universities, and so we really would like to engage them, and the planning is underway for a research roundtable aligns with goal 5. If you remember from an earlier slide, one of the number 5 goal of the national strategy to support family caregivers is about looking at evidence base and about research. And that's something that North Carolina is really well positioned for, since we have so many great researchers in the area. How can we bring everyone together? To continue to partner with Division of Aging, we have wonderful colleagues from the Division of Aging as part of our caregiving collaborative, and we plan to have them present to the group or continue presenting, as they already have, on initiatives they are working on. You've heard before about the No Wrong Door, Lifespan Respite, Dementia Capable North Carolina. So we're very involved with staying engaged and connected with all of our different efforts. And then we recognize that our advocacy efforts will be important as the effects from the federal bill recently passed impact state level programs and services, especially related to Medicaid, since these can negatively impact caregivers. And so working with, staying involved with the Medicaid changes, staying connected with our wonderful partners working on essential jobs, essential care, and that partnership between family and paid caregivers, and then also tag teaming with other partners. We're thrilled to be invited to join some conversations and advocacy work with Moms Rising. That's happening next week. And so any way we can connect our experiences and expertise and insight, we're happy to partner with folks. Next slide. Okay, and so this is where we do our kiss goodbye, and we invite you, if you are so interested, to get involved in our ongoing efforts. There's a number of ways to get involved. We have standing meetings the first Friday of each month at noon. In fact, the next one is this Friday, August 1st from 12 to 1. We have the Zoom link right here, and I think we'll try to also put that in the chat. You can email us and email myself or Karen. You'll have our email in just a moment, and I will add you to the calendar invite. And Karen sends wonderful updates with news and information, advocacy, and so we can make sure that you get on that listserv. You can get involved with the Landscape Analysis Project to help add resources for caregiver support. You can get involved in the Supporting Older Adults and Their Families work group, as we've been talking about today, through All Ages and All Stages, and Kay or Janisha can be contacted. So we really want to help include your voices and your experiences if you would like to be included. And then before we do questions and comments, let's go to the next slide. There we go. So we'll keep it on this slide, so that way we're happy to take any questions or comments, but here are our emails for Karen and myself. So if you would like to get more involved, we would love to have you. So with that, I'm going to stop there and see if we have any questions.
And I think, folks, you're welcome to put questions in the chat. We can capture them that way as well.
And Karen did just add, or Kaylee did, thank you, Kaylee, added the Zoom link for our monthly meeting. We recognize we put a lot out there. I think the takeaway is that there's a group of us that care passionately about issues affecting caregiving, and there's a number of initiatives we're working on and a number of things that we will continue to work on. So this is, as Karen said, and you heard in our introduction, this touches us personally as well as professionally, and so we're on it. Oh, look, there are discussion prompts.
As folks are thinking of questions they might ask, and again, sorry, this is Kay again. I just wanted to thank all three of you for not just your presentation today, but for the work that you're doing in this space in supporting caregivers and bringing your background and your passion to this work. It really reflects in your work and your presentation and what you all have done through the collaborative. So I just wanted to take a moment to say thank you. All right, and it doesn't look like we have any questions, so we've got some discussion prompts here. If anyone wants to share maybe something that resonated with you, anything you learned today, anything that would make it easier for you or your organization to get involved in this implementation, we welcome any thoughts and ideas. Got a quiet group on a Wednesday.
Okay, this is Mary Bethel. Thank y'all, everybody, for just a very good presentation, good overview of what's going on. Heather kind of got at this a little bit, but I think that one of the important things, we still don't know all the implications of the One Big Beautiful Bill that just passed, but we know it's going to have major implications on the Medicaid program in North Carolina. And that's going to impact not only a lot of folks who are receiving care, but it could impact a lot of family caregivers who also are now on Medicaid, particularly Medicaid expansion in North Carolina. So I think as we begin to learn more about what's happening there, this is going to be an area that's probably going to need a lot of advocacy on the part of all of us who are caregiver advocates in North Carolina. We'll see what comes down the pike, but it looks like it's probably going to have some pretty big implications.
Really great point, Mary.
I don't know if we have any more questions. I do want to say that we really appreciate each and every one of you for joining us for our first month-long webinar series showcasing all of our 4 goals as we formally kick off our implementation phase. We're actually very grateful for all of our featured speakers too. If you've been tuning in since the Strengthening Communities for a Lifetime webinar that was earlier in the month. Just want to say that all of the materials will be posted on our website by the end of Friday, as well as this webinar will also be posted on YouTube if you wanted to share it out with anyone who was not able to register or tune in. Our co-chairs, Joyce Massey-Smith, our director, as well as Mary Bethel, are really grateful for all the momentum we are building together, and we hope that each and every one of you can actually see how this work for aging intersects as we soft launch the collective impact model to guide our efforts into Q2. We do look forward to continuing this conversation. We will have quarterly webinars throughout the 10-year phase. So our next one is actually going to be in late October and early November. And if you have any guest speaker suggestions, we would love to hear from you all. I know there's been some interest in hearing about the dementia work in North Carolina, so that might be a consideration. And then if you did miss the opportunity to join one of our subgroups back when we launched our interest forum in May and June, we will open up the formal interest forum again in October. But if you're interested in joining any of our July or August meetings, feel free to reach out to both myself or Kaylee, and we can get you plugged into a group that is of interest. And with that, we do have some very brief closing remarks. We've been kind of saying this message throughout our entire webinar, but I do want to elevate this messaging that aging does touch all of us. It's not just something that happens at the end of life. It is a lifelong experience that affects how we live, work, and care for others and connect to our communities. And because aging is a shared experience, the responsibility for supporting older adults and their families does belong to all of us. And that's exactly the core mission of All Ages, All Stages NC, for us to all work together, not just the Division of Aging and our aging partners, but all of the systems to coming together. And caregiving and home and community-based services, as you all heard from today, are really essential parts of daily life, not just as optional or afterthoughts. Caregivers are our first line of supports for older adults, and they cannot do it alone. There are a lot of data we can share as well. And at the same time, we know that HCBS must be strengthened so that people can age in place with access to the services that make possible, whether that's transportation, nutrition, personal care, etc. So we are looking forward to launching a standalone HCBS subgroup in year 2 after the OAA final rule work. The current landscape does present challenges. There's a lot happening at the federal and state level, but we're really looking forward to working together as a team to help navigate all of our services and supports and working together, building blocks and putting in place. what we know is that intentional coordination is really important. And so we're looking forward to connecting all of the good work that is already happening and making it easier for people to get help when they need it and where they need it. And that's exactly what All Ages, All Stages NC is about. So thank you all again for tuning into our series. And if you're interested in getting involved, I'm going to turn it over to Kaylee to talk about the QR code we have for our website and then opportunities to connect your organizations to this work.
Thank you, Debbie. I was spotlighting myself. This is Kaylee speaking. So I just want to talk about how you can connect your work to the plan and how you can get involved. So identify where your current program, services, or policies align with one or more of our 8 priorities. And you can use this as a framework to strengthen and scale your impact. Champion the plan within your organization. So share the All Ages, All Stages plan with your teams. Use staff meetings and internal newsletters or planning retreats to explore how your agency can support implementation. Amplify the message. So help raise awareness by sharing the plan with local leaders, community partners, and stakeholders. The more that people understand it, the more momentum that we build. Share your success stories and lessons and things like that to inform the statewide efforts for All Ages, All Stages. Email us at the All Ages, All Stages nc@dhhs.nc.gov. And then join our work groups. As we move forward, as I mentioned, or as Divya mentioned, we are opening up another round in October, but we dropped our emails for myself and Divya in the chat. And if you are interested, please reach out to us and we can plug you in where your interest is at. And we thank you and we appreciate your work. Please use the QR code to find our plan. Sign up for our newsletter so you can get all the updates. And we look forward to you joining us next time and hopefully maybe our subgroups as we meet in the next coming months.
Thanks, everyone. It's great.
Thank you.